Hey, welcome to week 9, Healthcare Delivery Systems, part 2 of Health Professionals, the People in Healthcare. Last week we talked about the role of the physician and the nurse in healthcare. This week we're going to talk about all the other allied health professionals. So your learning objectives are listed there. And the first thing we're going to review is the physician assistant. You've probably heard of physician assistants. They're called physician extenders, and my hair's a mess. Anyway, part of their role is they are a physician extender, and they help the physician with their day-to-day duties, and they also serve in those areas where there's a primary physician shortage. I have a first cousin who's actually a physician assistant, and her role is quite significant in the clinic in which she works since there is a shortage of a physician. Most physician assistant applicants, in order to practice, they already have to have had a bachelor's degree. And some can have associate bachelor's and master's, but to get into a program to be a PA is quite competitive. As they're training, they have a preclinical and a clinical rotation that they have to do. And actually, they said the first year of PA school is almost the equivalent of first year of medical school. Okay, so to practice as a physician assistant, you do have to pass a national exam, and you also have to make sure you continue your continuing education units. Most states do require you to be licensed by the medical board, which is understandable. But the role of a PA is that you can diagnose and treat patients. You also have the ability to prescribe medications, and you also have the ability to perform hospital nursing home rounds. And this is significant because, for example, in a nursing home, new patients have to be seen by a physician at least once every 30 days. And existing patients have to be seen at least once every 60 days. So the ability to do this really relieves some of the time for a primary physician. Pharmacist, I'm going to let you read over a pharmacist, but a pharmacist plays a big role. Very stringent requirements to be a pharmacist. You have to have a doctor of pharmacy degree. That's been there since 2007. Need 2 years of general studies, 2 years of pharmacy school, 2 years of clinical pharmacy, and then you can get actually residency and fellowships. So a lot of training. Pharmacy, what you need to remember is they are an excellent resource for information on medication. And they can often provide you information that your physician can't, because they're trained to know the medications that they work with, the side effects, and things to watch out for. They do have to be licensed, and the licensure will vary by the state that they're in, but they have to take a state exam to become a licensed pharmacist. Their roles are dispensing medicine. They can be in a community or hospital-based, so you can have a hospital-based pharmacist. And consulting roles are usually hospital-based. Respiratory therapist, usually it's an associate degree, but you can get a bachelor's degree. There is a big push for all respiratory therapists to have bachelor's, but the 2 year is still there. For example, NICC at the Piasta campus has a 2-year program in respiratory therapy. So the certification is 2 levels. You can be a certified, a CRT, or a registered respiratory, or an RRT. They have to be licensed in most states, and they help provide assessments, patient education, and treatment for respiratory conditions. Another example is a physical therapy aide. This can also be done with a 2-year degree. It's highly specialized. You can also be a physical therapy assistant, which is an associate degree, or you can be a physical therapist at a higher level, and there you need a master's or a doctorate degree, and you do need to be licensed. Occupational therapy is much the same. You can go to a 2-year school to be an occupational therapy assistant or an OA, and their certification is called COTA, C-O-T-A. Licensure varies by state. You can also be a rad tech or a technician or a technologist. That's also a 2-year degree, and you have to go to a certified school. A rad tech, they help maintain and calibrate equipment. They position and control x-rays, and they can also do specific types of radiology. So for example, I have a nephew who is a rad tech, and where he worked, he helped with interventional radiology, and he helped actually in the catheterization lab and often helped with heart catheterizations. An EKG technician, they often do on-the-job training, and what they do is they're trained to read EKGs, and they're they have to basic knowledge of AMP and the electrophysiology of the heart, but they learn how to use the equipment and verify the quality of whether or not the tracing was good. Now, they don't make a diagnosis off the tracing, but they look at it and they can tell whether or not they got a good reading. They have to be certified. They don't need to be licensed. Then you have dietitians, and that can be an associate degree or a bachelor's degree, but then you have to take an exam to be a dietitian and maintain your CEs. You have emergency medical technicians, or EMT, and paramedics. Listed here are the differences between a first responder, an EMT, intermediate 99 hours, and paramedic. So you can see they have a lot of advanced degrees. For example, a paramedic, 1,000-hour training, so that's equivalent to a half a year's work, or an associate degree. And those are all the skill sets that they have to meet. Dental health, you can go to school to be a dental assistant or a dental hygienist. A dental assistant, depending on the state that you live, you can get on-the-job training, or you can get a certificate training or associate's degree. So for example, at NICC, we have a dental assistant program. We do not have a dental hygienist program. That requires either an associate or bachelor's degree. It's one step up from an assistant. Their specialty is oral hygiene and cleansing of teeth. They do have to be licensed. To be a dentist, you can specialize in dental surgery or doctor of dental medicine. Usually you need 4 years of college, 4 years of dental school, very intense, and you also have to be licensed. Mental health professionals are listed there. You can be a counselor with a master's degree, a psychologist, you need to be a PhD, and a psychiatrist is an MD. So there's a difference level in mental health professionals. For example, my mother was a licensed counselor for substance abuse, and she had a master's degree in counseling. A psychologist, you need a PhD, but to be a psychiatrist, that is actually a medical doctor degree with 4 years of residency and training. Many small communities can find psychologists and counselors, but psychiatrists can be hard to find. Social workers, you can get a bachelor's degree in social work or a master's. Bachelor's will focus on direct service to a client, but a master's will be more supervisory training. You do have to be licensed. Case manager is a little different. You can get on-the-job training. You can get associate or certificate programs, may include additional training, but case managers certification is a little bit iffy. You don't see them as much. So that concludes Lecture C. Read your transcripts for this. They will tell you more about each profession, and review your PowerPoints. This is the only time you're going to get this content in the 2 years of the program, so it's important for you to know all the different roles of the health profession.